MHPA for hosting us today. And I appreciate everyone spending an hour with us for the webinar Wednesday. I think we have a great topic, a very relevant one teed up for today's discussion. I'm going to start with some introductions for our speakers today. Just starting with a quick introduction of myself. I'm Catherine McPherson, VP of Product Strategy and Development, Chief Nutrition Officer at Mom's Meals. And I really work on all of our programs that are new, that are pilots. I work on clinical protocols with our partners and getting anything new and innovative off the ground. And certainly there has been a lot of innovation around the pandemic, seeing how Medicaid plans are really meeting the needs of their members. And we're going to hear from one of our wonderful partners about their innovative program today. But also joining me from Mom's Meals is Holly Spinks. She's our Senior Director of Strategic Partnerships. And Holly is a nurse and brings her expertise in her work with our partners. So that includes Medicaid plans like United Healthcare, hospital ACO partners on many programs spanning from post-discharge to chronic care needs, high-risk pregnancy, behavioral health, and many more. Also joining us today is Lauren Wetzlaw, who is the Population Health Liaison at United Healthcare Community and State Plan of Louisiana. So we've been working with Lauren in addressing the needs of her members in Louisiana. So before starting in her current role, Lauren worked at United Healthcare as a population health consultant, and she performed audits and education with providers on various topics like HEDIS and NCQA. So she has a lot of expertise. And Lauren is also a nurse and has worked in the emergency room in Northwest Louisiana and in New Mexico. So thanks so much for joining us today, Holly and Lauren. Right, and I'm going to share our agenda for today. So we've started with introductions for our speakers today, but we'll get right into introductions to our organizations. And then we'll talk about the COVID-19 crisis and food insecurity. We'll talk about how home delivered meals is such a critical benefit right now. And then we'll take your questions. So please enter your questions at any time into the chat. So I'll kick us off by talking a little bit about who Mom's Meals is. So Mom's Meals has been in business for 21 years now. We have expanded from our home office in Ankeny, Iowa, to deliver to every address in the United States. That includes Alaska, Hawaii, Puerto Rico. We are the only national provider of refrigerated home delivered medically tailored meals. We proudly work with many types of partners, including managed Medicaid organizations, Medicare Advantage, a lot of duals plans, directly with hospitals and health systems, directly with state and local governments, could be AAAs or Area Agency on Aging. And then we have an extensive private pay program as well. We work with our partners in three main types of programs: long-term services and supports, post-discharge care when someone's discharging from a hospital or skilled nursing, but also condition management. And that's very often chronic condition management like diabetes or heart failure. But as we're going to talk about today, it can also be, the management of acute conditions like COVID-19. So with that, I'm going to pass things over to Lauren for an introduction about United Healthcare Community Plan Louisiana.
Thank you so much, Catherine. Let me bring up my screen here. All righty. Everybody see okay? Okay, good.
Looks good.
Awesome. So I'm here representing United Healthcare today. We are the second largest MCO in Louisiana, serving our Medicaid population. We have roughly around 450,000 members. Our mission is to help people live happier, healthier lives by integrating evidence-based quality care that works better for everyone. We know that chronic diseases are unfortunately on the rise and account for 86% of the nation's healthcare costs. which in turn means increased out-of-pocket costs for individuals. It's because of this that we needed to pause and take a step back and look at what we've done in the past and where our areas of improvement were. And it was because of this pause that we planned, really started brainstorming some innovative ideas, but we needed to bring it back to basics, asking ourselves what are small steps that we could implement that would lead to impactful change. That led us to Mom's Meals, and while we were able to see the benefits to our post-discharge members and how having whole nutritious food was helping to aid in their healing, we were incredibly grateful for our partnership when the pandemic started. And I'm going to give it over to Holly now so that she can talk to you a bit.
Thank you, Lauren. Next slide. So as we talk about, COVID-19's impact on our vulnerable populations, there is no question that COVID-19 pandemic has had a ripple effect that extends far beyond our vulnerable populations. A crisis like this only serves to exacerbate pre-existing inequalities, which are putting our vulnerable populations at even greater risk for poverty and hospitalizations. With our older adults, we have seen an increased risk for severe illness. As shown in the bar graph to the right, from the age of 65 and older, the increased risk for hospitalization almost doubles. According to the CDC, 8 out of 10 deaths reported are in the range of 65 years old and older. Due to the inability to access adequate medical care, transportation, and nutrition, socially vulnerable populations are at an increased risk of health challenges. Next. Next.
Sorry.
Let's talk about how COVID-19 impacts social determinants of health. Before COVID-19 crisis began, more than 37 million people, including more than 11 million children, lived in food insecure households. Currently, Louisiana has one of the highest food insecurity projections for children at around 378,000, and California having a total number of food insecure people around 6.4 million. There is no doubt that this pandemic has caused a public health and economic crisis and has had many challenges for our members with social determinants of health barriers, such as reduced access to food. So due to social distancing, food shortages, closing of those volunteer programs, social isolation or compression, due to people either being isolated due to social distancing or having to move back in together, such as children or elderly relatives moving back in. Employment changes and economic hardships, job loss, changes in housing, homeless or at risk for homelessness, people unsure where they will live, changes in access to care, as loss of health insurance due to layoffs, fear of visiting a healthcare provider due to virus concerns. Next. The COVID-19 crisis provides opportunity for real-world application of human motivation to achieve fulfillment. The premise of Maslow's theory is that human beings are motivated to act based on needs, which progress from fundamental needs for survival to higher order needs for self-fulfillment. The challenges we are faced with today is that there are some individuals that can't even meet their basic needs. As an individual will never move through the tiers and have self-actualization if they are worried about the food or are living in an unsafe environment. Think about trying to manage a chronic disease with food insecurity. For example, a member that has diabetes is supposed to eat regular, well-balanced meals throughout the day. This is very hard to do when you don't know when or where your next meal is coming from. Back in my nursing days, I had a diabetic patient who was also homeless, getting ready for foot amputation, crying prior to surgery, saying, "I don't understand why my sugar is so high. I don't eat sugar." Due to lack of basic education about diabetes health and carbohydrates, she wasn't equipped with the tools to successfully manage her condition. So we ask ourselves, how did this happen? Remember, when an individual cannot satisfy their basic survival needs, such as shelter and food, it dominates their interest and concern. Next. This is a visual representation of food insecurities and disparities. Lovingly referred to as the boot, Louisiana has a population of around 4.6 million, very rich and proud of their culture, and quite literally a melting pot of races and ethnicities throughout the state. Similarly to some of the other states, they have a few large cities, but a large majority of their population lives in rural communities. The percentage of households in Louisiana that lack consistent access to food is still among the highest in the nation. The northernmost and northeastern parishes have the greatest disparities, and among those disparities is food insecurity, which leads me to our next slide. Because of their large cities mixed with several rural communities, Louisiana has several food swamps as well as food deserts. Food desert is where a supermarket is more than 1 mile away, and it has individuals facing difficult choices between meeting basic needs like healthcare and food. Convenience stores are often the closest and least expensive option. Another example of a food desert is in the area where Hurricane Katrina hit in 2006. It's that lower 9th Ward. There is no big box grocery located in this neighborhood. The solution to this would be to add pop-up pantries at schools or churches to allow the residents no more than a 10-minute walk of a grocery store, or to enroll them in a home-delivered meal program, which offers healthy options. Food swamps where healthy food choices are readily available, but vastly outnumbered by low-cost, low-quality alternatives. Typically, there's about 4 unhealthy eating options for every 1 healthy option. You can think of food swamps as like New Orleans. It's renowned for its lively music, wild antics, and completely delicious food that seems to be around you and every time you turn a corner. The disproportionate distribution of healthy food sources across the state contributes to the development of unhealthy behaviors among these communities, and the consequent disease burden deeply affects not only the individuals and the families, but the community as a whole. Members should have choices, but we want to empower them with healthier choices. Next slide. As the United States grapples with the widespread impacts of the global COVID-19 pandemic, Americans face health threats not only from the virus, but also from economic impacts that lead to growing levels of food insecurity. There has been such overwhelming research surrounding the negative outcomes to food insecurity affecting each age group. Nearly 60% of people in the United States enter a hospital malnourished or at risk for malnourishment. Almost 50 million people, 1 in 8, are food insecure in the United States, which means food insecurity is one of the nation's leading health and nutrition issues. In counties with high food insecurity, 1 in 8 have diabetes, 1 in 5 have disabilities, and 1 in 3 experience obesity. Next. Health disparities in incomes tend to have higher rates of unfavorable health characteristics, which takes a toll on the health of those individuals. Studies have shown that in food insecure households, they are in fact at higher risk for hypertension and diabetes among non-elderly adults. Most of these low-income, food insecure homes receive SNAP, and this is a program that is continuing to modify their offerings to attempt to encourage dietary shifts. We know with the encouragement and resources to shift dietary intake, towards healthy food alternatives could have the potential to prevent the development of diet-sensitive chronic disease and improve health outcomes. Food is really critically important for many of the diseases that are plaguing our country and the world today. Next. When we look at the health-related cost of food insecurity, in 2014, there was 48.135 million people living in households that were food insecure, which was an increase from 11.906 million in 2007, which was the year of the Great Recession. The total illnesses cost estimated for calendar year of 2010 was around 130.5 billion for the cost of food insecurity in the nation. So we ask ourselves, how can we increase health outcomes and decrease healthcare cost? Remember, the power of food is medicine, encouraging healthy nutrition that provides medically tailored food to prevent and treat serious illnesses in members, as opposed to relying on pharmaceuticals and other healthcare interventions, is absolutely essential to our healthcare system. Next. Social isolation and food insecurity are two problems that are often intricately interwoven for much of the low-income and senior population. In 2018, roughly 14.3 million older adults live alone, and 43% of older adults reported feelings of loneliness. Social isolation is costing around $6.7 billion in Medicare spend. Lacking social connection is as damaging to our health as smoking 15 cigarettes a day. People who reported feelings of loneliness also reported 5% more severe symptoms in the common cold than those who are less lonely. Addressing social isolation and loneliness is one aspect of the broader effect to address mental and behavioral health during the pandemic. As I get ready to turn this over to my guest speaker, I just want to leave this with everyone. With the COVID-19 pandemic, there has never been a more urgent time to recognize and address the causes and effects of social isolation. A home-delivered meal program not only ensures your members are receiving that adequate nutrition, but it can also provide health and psychological benefits. And with that, I want to turn it over to our guest speaker and our wonderful partner, Laura Wetzlaw with UHC of Louisiana.
Thank you so much, Holly. All right, so I wanted to talk a little bit about our pre-COVID snapshot and give you just a little background information as it pertains to Louisiana as a whole. While Louisiana is rich in culture, we are also rich in our delicious, also not always nutritious cuisine. My mouth is watering just looking at those beignets and the boudin well. The data from the USDA's Economic Research Service shows that on average, 15.8% of Louisiana households, 293,000 in all, experienced food insecurities between 2016 and 2018. And unfortunately, our health isn't much better. As you can see, Louisiana's top causes of death include heart disease, diabetes, kidney disease, and even cancer. And all of these things can be closely correlated to your diet. We've also noted that poor social relationships characterized by social isolation or loneliness was associated with 29% increased risk of heart disease and a 32% increased risk of stroke. Loneliness among heart failure patients was associated with a nearly 4-time increased risk of death, a 68% increased risk of hospitalization, and a 57% increased risk of going to the emergency department. Now, this next slide weighs a little bit heavy on my heart. While social determinants of health are not a new concept, right? There's been a recent light focused on it, and for very good cause. As Holly was speaking earlier about Maslow's hierarchy of needs, you really can't address or try to change the needle in healthcare when basic needs are being met. If you don't know where your next meal is going to come from, if you don't know what the nutritional value of that meal is going to be, you really can't take the next step and determine how that nutrition is going to affect your health. It really is a domino effect if you think about it. So what we decided when we started to do our research, we found our areas of opportunities and where we could make a difference. And I challenge each of you, based on your state, to look through your data and find where your opportunities might be. They might just surprise you, as I was surprised that 1 in 6 households in Louisiana struggle with food insecurity, 1 in 4 seniors struggle with food insecurity, and it's kind of embarrassing. Our overall state ranking is 50 out of 50. We definitely have some work to do, but I really feel like we're on the right path. And that's really what led us to start our partnership with Mom's Meals. We began our partnership in October of 2018 as a post-discharge benefit. We wanted to decrease the readmission rates to our members once they were sent home from the hospital. We were aware that malnourished patients are 2 times as likely to be readmitted to the hospital and have a 4 times longer stay. And by utilizing a benefit of home delivered meals, there is a 39% reduction in hospital readmissions. Initially, like many new business ventures, we set up a small model offering the benefit to our Medicaid-only members. But rather quickly, we started seeing the data and hearing from our community how much the program was valued. We then expanded the offering to our Department of Justice program, our Whole Person Care program, and Healthy First Steps, which is our maternal infant health program. The benefit included 7 days worth of 2 meals a day with an optional one-time meal extension for an additional 7 days. And then COVID hit. Louisiana, along with New York, were among the first states to be heavily hit by COVID-19. Maybe related to a little party that we like to have at the end of February that you might know of or have heard about, which is called Mardi Gras. And as the uncertainty continued around COVID, our rapidly apparent immediate need for food for our members presented itself quickly. As you can see, we had some large spikes early on, which prompted our governor to issue a statewide lockdown. Children weren't going to school, parents were unsure if they were going to be able to go to work, and our elderly and chronically sick population were afraid to leave their homes. It is because of all of these factors that we decided to open Mom's Meals program to everyone, regardless of recent hospitalization. If we go to the next slide, it will give a little bit of where we're at from a food insecurity standpoint in Louisiana. So as you can see, we've gone from 16.1% statewide food insecurity rate in 2018 to a projected 21.7% in 2020. Our child food insecurity rate has also risen from 24.6% to a projected 34.5%, with 208,640 individuals that are reporting food insecurity. Now we know that the data pertaining to race confirms that our African American population accounts for 46% of COVID deaths, despite being only 2% of the nation's population. And we have some heavily populated areas such as East Carroll Parish and Louisiana's 2nd Congressional District that are predominantly identified as Black or African American. Because of all of this information and data, we knew as a health plan that we needed to step up. That is why we took our post-discharge meal benefit and opened it to assist with our COVID relief. Everyone that needed help with food and reached out to us and let us know received it. And I'm happy to say that from March 23rd through June 1st, which is when the post-discharge requirement was lifted, together with Mom's Meals, we're able to provide nutritious food to over 330 individuals and families. and that's over 4,620 meals. I wanted to take a minute to talk a little bit about one of our success stories that stood out to me, and it means a lot to me personally. One of our members, a 34-year-old woman, gave birth and tested positive for COVID while she was in the hospital, was worried that she was going to run out of food due to social distancing. She was already only eating the food that was left on her children's plates and was not taking care of herself. She was trying to take care of everyone around herself. She was assigned a case manager that was able to reach out to us, submit referrals for each family member, and the member was able to receive food for not only herself, but also her husband and 4 children. With that decreased stress, the member was able to set up and attend a virtual postpartum visit, and that's a win in my book. And not only have we seen how, the members are directly benefiting from all of these wonderful meals, we are also hearing it from our case management. We've also received many, many thanks from our case management staff. They are our boots on the ground, and many of their emails and stories are heartfelt and touching. I wanted to share with you today 2 examples of many that we have heard from our staff. Jane wrote to me and shared statements saying that the program had helped so many. During the beginning of COVID crisis, when I offered this program to my members, the frequent response, "Bless you. Thank you so much. This will be a big help since I live alone. And also, I am a mother of a toddler and my mom is helping me out, so I know this will help her not having to make my meals." And Brandy wrote to me and shared after speaking with a mom who was tested COVID, they were able to get mom's meals approved for her entire family. She was extremely grateful, and we reached out and were able to assist her with her family needs. Mom's Meals is truly a wonderful program. Members have also expressed loving the meals and self-reported outcomes such as the meals helping unwanted stress and isolation that COVID had put upon them. Let's see. And lastly, I just a little bit about lessons that we've about 19 and as pandemic does. Obviously, there's lasting result, and unfortunately, the pandemic isn't going to go anywhere anytime real soon. It really highlighted a rise in food insecurity and the gaps in support. It showed us that food can be an effective intervention with a powerful impact. And then we've also had ongoing discussions at all levels, from the community to the state Medicaid level, and we're really looking at ways in which we can help to serve our population. So I just wanted to take a second and thank Mom's Meals from my heart. Thank you so much for everything that you've done for our members. It's been a wonderful blessing to have in our community. And with that, if anybody has any questions, please let us know, and I'll give it back to Catherine. Thank you.
Great. Thanks so much, Lauren. And thanks for your great presentation today and for your partnership. It's been our pleasure to serve your members. We do have some questions that have come in. So if folks are still thinking about, questions, go ahead and enter them into the Q&A now. So the first one, I think, Lauren, would be addressed to you. And the question is, well, I'm not sure what the school situation is in Louisiana. In many states, kids are now home that would have received free or reduced price lunches. So as you work with families, how do you coordinate with the school lunch programs if they are available? So have you come across that, Lauren, in Louisiana?
Yes, most definitely. I think definitely when the pandemic first started, that was a huge, huge area. Since we have such rural communities throughout Louisiana, there was definitely an increased effort amongst our schools. They set up car lines so that families could go and pick up meals. And I know that UHC also helped assist with that, as well as giving out food boxes. And then, like I said, when they opened up the meal benefit for our members, anybody that applied, including children, we were able to assist with mom's meals. And I know that that helped take so much burden off of our members and our community. Thank you for the question.
Great. Excellent. So I think this one would be best for Holly. So Holly, are food options culturally tailored? For example, can you talk about some of the different cultural menu options available on Mom's Meals, and maybe just if you want to address just the different menus we offer in general?
Sure, great question. We have definitely some options that are culturally tailored. We do have meals that are, tailored to that Latin culture. We also have kosher meals. We also have meals that can really appeal to the Asian culture well. Outside of that, we do have menus that are condition specific, such as diabetes friendly. We have heart friendly, we have cancer support, we have gluten-free, vegetarian. There's so many different options. So I'm sure there is definitely an option for any member to choose.
Great, excellent. So another question is probably for Holly. Holly, how does Mom's Meals help to address social isolation, since you mentioned that in your presentation?
Yeah, great question. So social isolation is getting a lot of, a lot of focus, right? And this is an area where Mom's Meals can really come in and help with the engagement of these members, making sure that we are having those touch points with the members, making sure that they know that someone is there for them, someone, that we're there to, not only provide meals to them, but we're also there for them to talk to them, listen to stories. So we really have shown a huge impact in that area.
Great, excellent. So another question is this program available in California? And maybe I'll just jump in and take that one really quick. Absolutely. So Mom's Meals works with, if you're from a Medicaid plan, we work with several Medicaid plans, Medi-Cal plans in California. We work with Medicare Advantage in California, and directly with some of the even MSSP sites. So absolutely, anywhere in California we can reach. So just reach out if you'd like more information. Another question is for, and maybe I can take this one as well. Do you contract on a monthly basis with Mom's Meals or weekly? I would say that this is dependent on the needs of the organization. So you heard us talk about maybe a shipment of 21 meals, maybe 3 meals a day for 7 days, or I'm sorry, 14. So 2 meals a day for 7 days would be 14 meals. So our meals are typically delivered on a weekly basis. They are refrigerated, so they come in a temperature controlled cooler right to the member's doorstep. And the contract is typically a year in length, but the length of your program can be determined. So if it's a shorter term program to address kind of a more urgent acute need like like the pandemic, or if you just have an ongoing need to serve your membership, it can be a longer program. So typically we write the contracts for a year, but we would indicate the duration of your program and then help you to create the benefit that's right for the needs of your members in the program. So hopefully that's helpful. So here is another, so there is another question here about payment through Medicaid. So I know we were talking a bit about this. So today, home delivered meals are not like a mandated medical benefit in the Medicaid program. And so how do Medicaid programs today, how do managed Medicaid plans pay for their meals programs? So I'm going to toss that one over to Lauren and hear a little bit about that.
Sure. So a large portion of the cost comes out of our administrative costs. Since it's a value-added service, it's not a benefit. That's how we have chosen to pay for the meals. And I can say without a doubt, it has been one of the best programs that I think that we have done for our for our members, especially, I mean, we knew that food insecurity to begin with was a problem within Louisiana. And then when the pandemic hit, we were so blessed to have this already set to place so that we could help our members. So, you know, we were given a smaller budget initially, but because it was such a benefit and it's helped so many, we've actually increased our budget by as much as, like, I believe it's 30%. I don't have the exact numbers, but it comes from administrative costs. So
great. Thanks, Lauren.
hopefully that helps. Yeah.
That's very helpful. And there's a second half to this question as well. And it's kind of about how does Mom's Meals work with the, you know, our partners? Is it typically around like invoicing and things like that? So again, it would depend on the program itself. Typically, Mom's Meals works as a provider, and we're going to submit electronic claims. In some cases, there can be invoicing, so it's very flexible. But if you have more specific questions about a program that you'd like to get set up, please feel free to reach out to Holly or myself, and we're happy to, you know, talk you through the specifics of your program. All right. There is another question. I've heard a lot about food insecurity, about insecurity in a food desert, but a food swamp seems like a very difficult and different challenge. Can you speak more about how you educate the family on food choices in their community and what kinds of meals you provide in these areas? So maybe we'll start with Lauren and maybe have Holly add on to, yeah, how do you educate about making healthy choices in a food swamp?
Absolutely. I think it's difficult, right? It's difficult for me as a healthy individual, but individuals, you know, the basics, what good healthy foods are, what colorful eating the rainbow means, you know, and a lot of that is done by our outreach and with our case management team. And then also Mom's Meals provides a wonderful support system. I mean, I receive a referral, right, from one of our case managers. I review that referral and then I submit it to Mom's Meals. 24 hours, the Mom's Meals contacts the member to talk about their food choices and talks about their health and, you know, if they have diet and things like that. I think that they provide a lot of education as far as carbohydrates go. There's the low salt, reduced sodium diets. And so it is really hard in food swamps to make good, nutritious choices. But I think, and I truly believe in my heart, that when you give people the knowledge and the power, then they will, you know, continue to make good choices. So, and I think maybe even Holly could speak to this even better than I can. So.
No, I think that's great, Lauren, and that's so true. At Mama's Meals, we do support our plans. We have dietitians, so we have nutrition education, and if there's ever a question, our case managers or even the members can ask to have a dietitian referral where they can talk about, you know, being able to make these choices and what are the best choices. But it is a partnership between Mom's Meals and UHC to have these discussions with the members so that once the meal plan has ended, that we know that they can be successful and make the right choices if they are in a situation where they're choosing, you know, in a food swamp, they're choosing between a healthy choice and a non-healthy choice.
Great. All right. Another question, and I think I'll tee this one up for Holly. Do you serve homeless individuals who do not have access to refrigerate their food?
Yes, that is an excellent question. As you know, the homelessness and risk of homelessness has really increased, right, during these times. We do have shelf-stable meals that can really help this population. So, you know, they don't need refrigeration, they don't need ways to heat up these meals, and they have everything all there for them, the condiments, the silverware, all of the things that they need in these boxes that we prepare for them. So it really is a complete meal that they can really enjoy.
Great. Thanks, Holly. So another question is, I was curious about the logistics of Mom's Meals. Where are the meals prepared and who supplies the food? So I think I'll jump in and take this one. So we prepare our own food. We cook our own food, which is just wonderful. We have 2 USDA inspected kitchens. There's one in Iowa and one in Ohio. And we prepare all of the meals. We have a team of executive chefs and registered dietitians that plan, how to create seasonal menus that are going to delight people, yet be compliant with all of the condition-specific guidelines for the menus we support that Holly talked about. So we're creating the menus. We are sourcing and cooking our own food. We are, plating that, putting it into trays, and then we're actually picking individual entrees selected by members based on, their allergens. So is the food safe for them based on their preferences? So that includes their, cultural preferences and food preferences. So if someone doesn't like mushrooms, they'll never get mushrooms. If they don't eat pork for religious reasons, they're not going to get pork. So we actually pull the meals and create that individual cooler for that specific member. So our program allows for choice of every meal that someone is going to be receiving, which is really important to member satisfaction, but also to autonomy. We all got to choose what we had for breakfast or lunch today, and providing people the dignity to do that in a program is really important. And so those are some of the logistics. Holly touched on a little bit about social isolation. So we do have a team of folks who are making outbound calls to, talk about when that delivery is going to happen, talk about how to store, the meals when they arrive, and, be that friendly voice on the phone. That's the extension of the health plan. And then the deliveries also happen through a variety of means. We do, work with, third-party carriers to really get meals to any address quickly. But we also have, a very large fleet of our own drivers and trucks throughout the United States that are delivering meals right to people's doorsteps every day. So we have a combination of delivery methods as well. So that's kind of, the logistics end to end. But thanks for that question. So I think, Patrick, we have reached the end of our questions. So I guess I will turn it back over to you.
Yeah.
I do just a big thanks to Lauren and to Holly. Thanks so much for your expertise on today's session. Back to you.
Thank you.
Okay, thank you so much, Catherine. And then, of course, again, Lauren and Holly for this very timely and important presentation. I was fascinated during the entire thing. Learned a lot. And in closing, I'd also like to thank the attendees so much for your questions. We had a lot of great questions. Thank you for just being here. You will receive an email with the recording of this great presentation, as well as more info if you want to get your hands on the slides as well to contact the presenters. We'll make sure you have that as well. And keep an eye out for more webinars at MHPA. We have them on Wednesdays, typically with our partners. And again, thank you to Mom's Meals. They are a silver partner with MHPA, really support us in our efforts. So again, thank you so much, Catherine and your team. And with that, I'd like to send everyone a great afternoon and enjoy your week. Bye-bye.
Thank you, everyone.
Thank you.
Bye-bye.
Thank you. Thank you so much. Bye-bye.
Thank you.